This is Rachel, an obstetric nurse, and I'm here today to talk specifically speaking about how to stay organized during your shift in labor and delivery. To stay organized, it's best to write things down, and some people call them cheat sheets or brains. Basically, it's just a piece of paper or papers that you write all of the information that you're going to need for your shift regarding the patients that you're taking care of. Now, the facility that I work at, we do usually 1-to-1 ratio. So one labor and delivery patient for one labor and delivery nurse. And so there's some wonderful, brilliant people in my department, other nurses who have come up with these brain sheets that I'm just going to give you a glimpse of. So, you can start off very basic, where you're just writing out some of the information that you're going to need for your shift. So this is just letting you know, like, the patient's name, the room number, their gravida parastatus, all of the different things that you'll probably need throughout your shift. This obviously was handwritten. Then we have some that are a little bit more in depth, that look a little bit better organized, lots of room, lots of white space to fill in before your shift starts. And then when you're getting report from another nurse, you can kind of go ahead and start filling that information in. As you get patients that are more, the acuity level goes up or increases, there are other sheets that you can use to kind of fill in. Let's say they're on magnesium sulfate and they need to be checked on every half hour for respirations and then vitals on the hour. So there's a lot of ways to stay organized. What I love to do when I start my shift is to use a separate color than the black pen that I use throughout my shift when I'm taking reports. So, for instance, I will use pink, purple, green, blue, really whatever, when I'm getting the information from the previous nurse and we're going through a report. I write down all of my information down in a separate color before my shift is started. And then as my shift starts, then I switch to my black pen and I continue on and write down all of my information that happens during my shift. That way when I give report to the next nurse, I know what I've done on my shift and what the previous nurses told me, and then together we can paint the best picture for our patient. So that's a little bit of how I do it. Now, stay tuned for the next video because I'm going to explain to you and give you an example of one of those cheat sheets or brain sheets and what they look like.